has always bothered me, and Fred had seen an episode of The Doctors and had mentioned it, so I did some internet searching and found Dr. Groff. After seeing the doctor's procedure and show on the internet, I was able to get a hold of him, did an email consultation while he was able to explain to me that this is something that could be treated with lasers and some other therapy, so I decided to give it a shot and see what he could take care of it. No, I haven't. I've always been a little embarrassed by the situation. I wasn't sure if it was just me, but after doing some research and seeing that it was a little more common, I worked up the courage to get a hold of somebody and deal with it.
Hi, Dr. Groff.
Nice to meet you.
Yeah, thanks for coming in. So, Stephen, tell me, how long have you had the PPP?
I don't know, it's something I noticed when I was a teenager, and it's kind of always bothered me, but I never really knew how to deal with it.
Right. Have you tried anything at all to take care of them?
No, I've always been too embarrassed to deal with it.
Okay.
I kind of noticed after seeing you on The Doctors that it was something that was treatable, it was common, and wanted to give it a shot.
Yeah, it's actually probably about 30% of guys have these bumps. I mean, some cases are worse than others, of course, but it's nothing you did. It's not sexually transmitted. It's really just a normal variation in male anatomy. So the good news is that you can't pass it on to anyone, or it's not really a medical problem.
So when I was doing my research and I found your videos, I saw a lot of people had mentioned there was a lot of advertising for creams and topical things that you could use. Does that really work?
You know, I've seen those ads, and there's absolutely no topical that'll work. The only thing that works consistently and safely is the CO2 laser. I mean, if it was as easy as a cream, you know, everyone would obviously use that and it would be quick and done. But, you know, if you think about it, it doesn't really make much sense. If the cream could take care of the spots, those spots are just normal skin, so it would have to take away your normal skin too. So it's one of those internet things, kind of a scam that it doesn't really work. So, well, actually, the great thing about our procedure is we use a very strong numbing cream, and guys feel absolutely nothing. I've done probably at least 500 of these cases, and no one feels a thing. So what we do is we put the numbing cream on, and we have you sit for about an hour, and that numbs the area completely. You can see I'm pointing to the beam of the laser there, and it's only about the size of the tip of this pen, so I can focus that on each one of your papules. And when I fire the laser, it actually vaporizes the papule instantly. You will feel nothing. There's no pain at all with the procedure, which is pretty amazing. Generally, the procedure only takes maybe 15 to 20 minutes in most patients.
And that just heals naturally?
It heals naturally. It usually takes somewhere between 7 to 10 days, and then you're back to normal activities. So this is the Ultra Pulse Encore CO2 laser. This is the laser that I've used to treat over 600 men with PPP. I can honestly say that it's probably the safest treatment that I do in our practice, even though we have over 40 different lasers. This treatment, I've had 0 complications, and patients are universally happy with the treatment. So I wanted to demonstrate for you guys how the CO2 laser works. So we have a cucumber here with some tiny bumps on it. I'm going to show you how the CO2 laser works to vaporize the bumps, and that's exactly how it works with the Pearly Penile Papules. It vaporizes each bump, and the lesions heal and go away. So if you look on the back of my glove, you can see a small red dot. That's the aiming beam of the laser. So I aim that spot on each individual papule, and when I fire the laser, you can see you get a tiny little superficial wound. Then that's exactly the reaction you get with each papule. So I can aim this red dot on each papule and vaporize the PPP, each one individually. So it creates a very superficial wound. It heals very quickly and without complications. Hey, how's it going? Good to see you, Steve.
Nice to see you.
How'd your recovery go?
Good, real well.
How long do you think it took you to kind of recover from the procedure?
It wasn't bad. It was like a week or so, like you said.
Yeah. And was there any pain or discomfort at all?
No, real mild.
Okay, good. And it's been what, about 3-4 weeks now? So have you been able to return to normal function, sexual activity, that sort of thing?
Yep, it's been great. In fact, it's gone even better than before because now I'm not embarrassed by it.
Oh, well, good. Well, that's the whole reason we wanted to do the procedure in the first place. you have any more questions at this time?
Is there any chance this is going to come back?
Of all the cases I've ever done, I've never seen any papules come back. Now, there is a small chance that as time goes on, you could get a new one. But if that happens, you can come back and I'll touch it up for you, no problem, for free.